Good afternoon and good evening. My name is Munish Gupta. I am the Secretary of the Foreign Correspondents Club of South Asia based in New Delhi. Welcome to another very special webinar in the series of webinars that we've been conducting from the Foreign Correspondents Club. Today is not so much of a webinar, but it's actually a live panel discussion with some of our colleagues from the media, both international and domestic media, for FCC South Asia in collaboration with UNICEF India to mark World Children's Day, which will actually fall on the 20th of November. But this is an entire week, marking activity around children. Today, we have a very special subject that we are going to discuss. And as we know, the world is enduring or suffering the pandemic of COVID-19. So today's subject of discussion is the impact of COVID-19 crisis on children in India. I will request my esteemed colleague and the president of the Foreign Correspondents Club of South Asia, Mr. S. Venkat Narayan, to introduce the panel and take this forward. Venkat, please.
Thank you, Munish. A warm welcome to you all, ladies and gentlemen. It's a pleasure doing one more event with UNICEF in India. We have done several in the past. I have the pleasure of introducing the panelists this evening. The first one is Dr. Yasmin Ali Haque. She has been the representative in UNICEF India since July 2017. Earlier, she was the Deputy Director of UNICEF's Office of Emergency Operations with a leading role in the programming and policies for an effective UNICEF response for children in humanitarian crisis. Dr. Haque served as the first UNICEF representative in South Sudan from 2010 to 2013, and from 2007 to mid-2010, she led the UNICEF Ghana office as a deputy representative in Sri Lanka. During 2004 and 7, she was responsible for guiding and coordinating the UNICEF program of support as well as emergency response to the 2004 Asian tsunami. In a keynote comment, Dr. Haque will explain how the COVID-19 health crisis has become a broader child rights crisis. She will highlight the socio-economic impact of the containment and mitigation measures around the world and how it has been potentially catastrophic for many children. An entire generation may suffer, with millions of vulnerable children losing out on their development and learning opportunities and their right to service and survive and thrive. The reduced access to life-saving vaccines as COVID-19 has put enormous pressure on already weak and overstretched health systems will also be discussed. Dr. Dhir Jhingran is the founder, director of Language and Learning Foundation. He has worked in the primary education sector for over 2 decades within and outside the government. As an officer of the Indian Administrative Service, IAS, he served as Principal Secretary, Education with the Government of Assam and as Director in the Ministry of Human Resource Development and Mission Director of Sarva Shiksha Abhiyan. Dr. Jhingran will speak on the ongoing learning crisis and the impact of COVID-19 on children. Enakshi Ganguly, she is the founder and advisor Haque Center for Child Rights. May I now invite Zafrin Chowdhury. She is the Chief of Communications, Advocacy and Partnerships for UNICEF in India. Ms. Chowdhury.
Zafrin, you have to unmute yourself.
Sorry about that. Good afternoon, colleagues from the media. Thank you for joining us. Thank you, Venkatji. Munish ji, and greetings to our esteemed panelists and all those who are watching. You have heard that we have gathered on the occasion of World Children's Day, which is on the 20th November. Every year, 20th November comes with a deep significance for children in the world and a legacy that dates back to the last century, 66 years to be precise. The World Children's Day was established in 1954 as Universal Children's Day and was celebrated on this day, on 20th of November each year, to promote international solidarity, awareness, and to inspire action for improving children's rights and well-being. On 20th November 1959, the UN General Assembly adopted the Declaration of the Rights of the Child, and also on 20th of November in 1989, the UN General Assembly adopted the Convention on the Rights of the Child, which is popularly known as the CRC, which is the most universally ratified convention. And that is the foundation of all our work and all the work of the organization and activists who work toward child survival, development, protection, and participation. The World Children's Day offers each one of us an inspirational entry point to advocate, promote, and celebrate the rights of children, translating into dialogue and actions that will build a better world for children. This day comes with a different and a special significance this year in the face of the pandemic. From the National Children's Day of India on the 14th November, we have kicked off a week of activities that are leading up to the World Children's Day, and today's, this webinar and media panel discussion is part of those activities. We will, like the previous years, the Rashtrapati Bhavan, the Parliament Bhavan, the Qutub Minar will go blue this year, along with many other iconic buildings across India and the states to signify child rights. In the face of pandemic, this is not a celebration this year, but we will still go blue and organize children's takeover, because it brings us together in solidarity and reminds us that the pandemic recovery must be child-centered. Our partners and young people themselves are working for every child and every right. With those messages, we are going forward in observing and marking the World Children's Day. Despite the restrictions imposed by the pandemic, a series of activities are happening in the virtual and digital spaces. Children will also wear masks and maintain the physical distance, and they will join virtually in most cases. That, however, doesn't mean that the children's voices will be any quieter. Children will be masked but not muted on this World Children's Day. It is time for us to take part in all our respective positions, the professions in which we are, the places where we are, for generations to come together and to reimagine the world we want to create as a safer, better world for children. On 20th of November, kids will reimagine a better world for themselves. What will you do? We need to ask ourselves, what shall we do? And that is what the point we want to press home today. With that, I will request Dr. Yasmin Ali Haque, UNICEF representative, to deliver her keynote comment. Thank you.
Many thanks, Zafrin, and greetings and a big thanks to all of you who are participating. Munish ji and Dr. Venkat ji, this is really a great honor for us to come together, albeit virtually. In my previous 2 years here, we've always ended with a very nice dinner in the garden of your beautiful center, but this year that's not going to be possible. This year we're hoping we give you a lot of food for thought and really give you a call for action. I have our esteemed other panelists here who will go into the depth of the issues that we want to put to forward to you. The first thing, of course, is we do celebrate. We celebrate the fact that India has made incredible gains over the past decade or so for children. We've seen neonatal mortality go down below 600,000. We've seen the deaths of children under 5 years go below a million. We've seen how the burden of malnutrition continues to generate action among all partners. We know that with even with all the great gains we've made with Swachh Bharat, there still are millions of people who do not have household toilets. Yet we also know that now the push is really to reach the 560 million people who are without household tap connections. So incredible gains, a lot more ambition moving forward. Yet COVID-19 pandemic has really brought with it the potential of reversing these gains. We've seen the impact on the economy of India. We've seen the impact on migration, and I think we are all haunted by the visuals of the people, the tens of thousands of people who were on the move to get to a place that they felt safe about. We know about more than 118 million jobs that have been lost, and the distress that this is causing, especially to those who are most vulnerable, those who were living on a day to day basis. We've also seen the impact of misinformation, of how it has driven fear, it's driven stigma, discrimination, and blame, with heightening the complexities of the disease, with really a need for more and more attention to social cohesion at this time of crisis. Now, the face of the pandemic is not that of a child, yet the secondary and long-term impact on children is going to be grave unless we take action. We know that the deepened poverty across every dimension of the child's life, whether it's in health, education, nutrition, water, sanitation, um, because of the household incomes going down, because basic services have been disrupted, we know that this is affecting children. The lockdowns, the fear of contracting disease, and the fear of really what the potential effects can be of even going for immunization that is life saving for children is something that parents are worried about. We've seen that when children's whole routine has been disrupted, their regular routine of going to school has been turned upside down. They are not able to socialize with their friends. And that has added more layers because within the house, we have seen a surge in violence, especially in domestic violence. So, really, what we are seeing is the COVID-19 pandemic has unfolded as a child rights crisis. Of course, we have been acting to address it, to assess the risks, to assess the effects, and to find solutions and ways of mitigating it. And UNICEF has been proudly working with partners and counterparts to ensure that over 660 million children and their families have been reached with COVID specific messages. We've reached about 3.6 million people um, with ongoing wash supplies, water, sanitation, and hygiene supplies. About 2.5 million children have received or have been receiving the care in terms of infection prevention. Um, we estimate that about 45 million children have had access to education initiatives, some digital, some high tech, some low tech, and some no tech. Um, we estimate that close to 20 million children and women have been receiving the essential health care, and over 330,000 children and their caregivers have been provided with psychosocial support, which is so crucial in this time of distress. We've also made sure that we keep engaged with people, and we estimate about 62 million people have been engaged in a two-way conversation, not just being given out information, but also engaging in a dialogue with them. And just to finally highlight that we know that children with severe acute malnutrition have started getting their services, and we're estimating that with the support in the states where we work, over 100,000 children have been receiving this treatment. But the two areas that we particularly want to focus on today, and that's where Dr. Dhiranjan and Enakshi Ganguly are going to really dig deeper into the issue, is that of the two major crises. One is the learning crisis, and the second is the child protection crisis. So Dr. Dhir will talk about it, but consider, 1.5 million schools across India are closed. If we count the children who are already out of school to those who have not been able to go to school since the pandemic started, we're talking of close to 300 million children. The digital divide is real in India because only 1 in 4 children has access to internet and digital services. And we know that the whole aggravation of their situation, the stresses at home, is exacerbating their psychosocial well being. UNICEF led community assessments have also shown that for the 6 to 19 school going cohort, only 2 in 10 in rural areas and over 3 in urban areas are able actually to attend online classes. So it's really a crisis. The other crisis, of course, is the fact that the pandemic is pushing families into negative coping mechanisms. We've seen an increase in distress calls, and Enakshi is going to be telling us more about that. And we're already seeing how the coping mechanism is leading to children being married off early, like the 16-year-old Nikita in Bhopal, whose family found the financial difficulty so hard that they decided to reduce the number of mouths they have to feed by arranging her marriage. We also know of the 12-year-old Gaurav in Ranchi, whose school closed down. The family had a mobile phone that ran out of recharge. Their father lost their job. They don't have a TV to watch lessons on TV, and he himself is now working as an auto mechanic or helping the auto mechanics. So we've seen that unless we're setting up referral mechanisms and focusing on the social norms to protect children, we are going to be slipping behind. Now, we have invested in partnerships for community based monitoring of some of the most vulnerable population groups because while um, we look at universal services, we also do have that obligation to specifically look at communities that are at the highest risk. And for that, we have worked with partners on the ground for community based monitoring. We've just completed two waves of it, and we're in the third wave. And the second wave was for the period of August September 2020, and it's really to take a snapshot to see how are people faring, are they getting access to the services, what are their concerns, and how do we need to adjust our advocacy and our support in any way. So it's been done really to monitor, to get insight into the situation of children and families. And it's not meant to be nationally representative. It's really to help us keep our finger on the pulse to an extent. So we've selected samples based on high rates of infection and vulnerability in 12 districts in 7 states. The findings show us that while the economic situation of families under the study remain challenging, selected services have improved compared to the results of wave 1, which was in June, July of this year. So we're already seeing that steps being taken are supporting people. We found that approximately 3/4 of the main wage earners in families reported that their monthly income is now lower than pre COVID. In urban areas, just 64% of wage earners stated that their family had enough food for the next week. In rural areas, the situation was a bit better at about 79%. But think of the 20 to 30% who do not have enough food for the next week. About two-thirds who receive cash assistance told us that the assistance is not really enough to meet the costs of food and other household requirements. About 75% of the respondents told us about the fact that the family have a debt burden due to the pandemic, and nearly half of them had to sell their personal belongings. So we see the stresses on these population groups adding. Of those who were aware of the government's cash assistance scheme, about a third of them were receiving, and more families in rural areas were receiving the cash grants compared to urban areas. The debt due to lockdown, of course, is something that we have to keep an eye on because it is going to keep increasing the vulnerability. The other issue that we try to look at, and which is a very live issue for us, especially those of us who are here in Delhi, that the continuation of COVID appropriate behavior. It's not enough just to give the messages in different forms, whether it's by poster or on radio or TV or some form of community engagement. We need a diverse toolbox to slow the spread. And as we look at the other interventions, such as diagnostics and treatments and infection prevention measures, the fact that simple measures that we have been advocating for years about in terms of hand washing, physical distancing, and mask wearing, we have to keep working on that. We are seeing a resumption of the health and immunization services. Outreach campaigns are improving, and we know that we are going to be in catch up for the months to come, while we keep as much a handle as we can to reduce it. So, as you're gathered here today, definitely the ask to you is for us to for you to really continue to be our critical partners. The FCC have been a strong partner for UNICEF. COVID-19 pandemic, it poses one of the biggest crises we have faced, and we need your support to advocate for a child-centric approach in the recovery for the pandemic. The cost of the pandemic for children are immediate, and if we don't address them, they're going to persist for years, especially the psychosocial effect that children are facing. So while we work on the various elements, we would really look to you to also amplify the voice of young people, their concerns, their urgency of how COVID-19 is jeopardizing their present and their future. And really do join us and give us your voice, your time, and support us in this World Child's Day and beyond. Children in India definitely need your support. Thank you.
Thank you, Dr. Haque. Thank you very much. Those were very good comments. We've started the discussion on a great sort of focus. Let me now request Dr. Dhir Jhingran, founder director of Language and Learning Foundation, to give his
Thank you,
remarks.
Munish. Thank you, FCC, and good afternoon to everyone. I'll focus my comments on the education and the grave learning crisis that Yasmin alluded to, with about schools being closed for almost 8 months and 250 million children not being able to receive education. It is one of the gravest learning crises that we have ever faced. The learning loss that children have suffered over the past 7 or 8 months is huge. Our organization did a baseline study in 3 states, and we found that on an average, about 20 to 25% of learning loss has occurred for children at the primary stage of education. Almost all students have been affected. The learning loss, though, is more severe for younger children whose foundational skills had not stabilized. There are huge rural and urban differences also with gender. And learning disparities, which were anyway quite prominent in our education system, have got exacerbated. Uh, the digital divide, as we all know, is really sharp in our country, with just about less than a quarter of the households having smartphones, and the access to children for learning being even lower than that. Parental support is very differentiated across different households. Uh, and we know that during this period, uh, there have been a lot of vulnerable livelihood situations, and children have suffered on that account. So, basically, a grave learning crisis, and also highly differentiated and with increased disparities. A lot of work has happened in the past few months to try and address the learning of children. Uh, in the first 3 months, the focus really was on creating digital content, trying to provide online classes, especially in metropolitan areas, and also to send out digital content on WhatsApp, and get children to do homework and send it back on WhatsApp. We do know that this has grave limitations. There's been a recent study which Azim Premji Foundation has just released, talking about the fact that digital access is so limited. Online learning has also not been very effective. And also, about 90% parents want schools to reopen and are willing to send children back to school. After that first phase that was really focused on digital content, uh, several states, and I'm talking about this from the public education system, the government system perspective, got their act together and created content which is on radio and TV. And that has been quite useful, except that it's not been very structured according to the curriculum required for each grade. Over the past 2 or 3 months, I would say, from the beginning of September, once the lockdown had eased, there has been an initiative to start community-based classes from the government, for example, in Chhattisgarh, and also from several civil society organizations like ours, where workbooks and textbooks, etc., have been reached to children's homes, and a teacher or a volunteer uh, actually does teaching physical classes in small groups, observing all kinds of protocols and safety protocols. So there's actual teaching that happens in small groups. Somewhere it's called mohalla schools, and there is follow up with on phone and IVR calls with parents to just ensure that they're engaged with children's learning, and some rudimentary effort like we do to track children's learning. Not very systematic, but still to see which children are learning and where there's a problem. Overall, if I was to summarize the effort at addressing the learning crisis in the past 6 to 8 months, I would say it's been of uneven quality and also uneven access. There hasn't been a clear structure to it that takes children from where they are to compensate for the learning losses and achieve some learning gains. There hasn't been enough assessment and tracking of children's learning, and obviously it is difficult to do. The one great positive that I must point out here is this, that the entire public education system has realized the important role that parents can play in supporting their children's learning. And this is something which is likely to serve us in good stead once schools reopen. Thank you.
Thank you, Dr. Dhir. Very focused remarks. We have a question. I guess a lot of our friends are watching. We have a question from Mr. Tim Witcher. He is the bureau chief of AFP. And he says, for many children in many countries, poor and rich, the past year has been nearly a wasted year of education. What should be done for them? Should they extend their time in school for a year? That means, do you feel that parents and the government or the administration should come together and say, okay, sometimes kids have been taking a gap year, but that usually happens later in life. Should we extend the school year by a year? And then the second, just so that you can answer these two together, is if schools were to reopen. I mean, if there's a big if, I am on one of those groups for my son here in Delhi, and there's literally 70 to 30% parents against school reopening. So if the schools were to reopen, what needs to be done? Those are the two questions. Thank you.
Right. Thank you. So, to the first question, I would say that schools actually must reopen, and they will reopen when we are not very sure, and it all depends upon when it's possible to open schools safely, with ensuring everyone's safety and health, and that would determine if this was going to be a fully missed out a gap year, or a kind of truncated year, because in India, certain states are thinking that if by some chance schools can open in January, which is unlikely, they could extend the school year until July or August, so giving at least 3 or 4 months in a truncated school year, uh, and then start the next year after that. But nothing is sure. It's a wait and watch for everyone, because state governments cannot take the decision. It has to be decided by the Ministry of Home Affairs here. And even after that, the states are going to be very careful, and probably the higher grades are going to open first, secondary school, and then middle school, and then primary classes at the very end. So right now, there's been no discussion in the country about declaring this as a gap year. Everyone's still hoping that with a truncated school year of 3 or 4 months, they would do something appropriately, so that children can be supported. And I'll come to that now in the second part of my response. Uh, so my response to the second part is, what should happen when schools reopen? I think it is a very complex. It's going to be a very complex year, not just 1 year. Its effect is going to be at least for 2 years at the minimum. So I think the first thing is to ensure that children receive socio-emotional, psychosocial support when they join school first. A lot of them have gone through difficult times in these past 8, 9 months or a year, in terms of either abuse or very difficult, hunger and health issues, etc. So a lot of socio-emotional support at school level. But the most important in terms of learning is this, that teachers and the school system must understand what their levels are when they join school, and begin education from there, rather than teachers trying to cover the syllabus, from the textbook from cover to cover, but start from where children are at that point, and do a lot of what we say remediation or reinforcement and revision. For example, a child who comes to grade 4, having missed an almost entire year of grade 3, and having forgotten a lot of what the child actually learned in grade 2 before schools closed, we should begin with remediating and revising what should happen in grade 2 first for a few months. Then again, some accelerated catch up for grade 3, and then only then try and bring up what is expected of the grade level curriculum of grade 4. So very aligned to what the situation is. The teaching should be in a very structured manner, like a week-wise arrangement of what should be taught in this week, how have children done, some assessment. And equity should be the cornerstone, because we have to support those children who are struggling, because they need the most support. Equity has always been important in the school education system, but much more so now when schools reopen, so that differentiated support is provided to children who are falling behind. And as I said, one big learning from the pandemic has been schools to establish much greater connect with parents after schools reopen, so that they're then able to get parents engaged with children's learning. So these are some of the things that we could take care of once schools reopen. Thank you.
Well, thank you. Those were very good, great answers. We have more questions for you, but we'll come back to that after we have the next speaker give her remarks. So let me now request Dr. Enakshi Ganguly. She is the founder and advisor, Haque Center for Child Rights, to tell us about the impact on child protection, invisible impact on children's future. Please.
Thank you, UNICEF, and thank you, the Foreign Correspondents Club, for having me here. A few months ago, describing the increase in domestic violence across the world, UNIFEM had UN Women had said that it was a shadow pandemic. I think what they missed was the child protection crisis that has been created following the pandemic. And it, as we believe, it is invisible, but it isn't actually, because we can slowly see it in all the news reports that are coming to us. The pandemic has disrupted the world that children have been familiar with. Disruptions to families, friendships, daily routines, and school attendance all have had a negative consequence, as Dr. Chingran has pointed out about the schools. And their mental and physical being has taken a beating and have exposed them to protection risks. Measures used to prevent and control the spread of COVID-19 also exposes children to further risks. Heightened tensions in the household, added stress placed on the caregivers, economic uncertainty, job loss, or disruption of household livelihoods, and isolation are placing children at a greater risk. With schools closed, many parents are out of work and families are under increasing strains. Girls are facing the real risk of dropping out of school and have added responsibilities to take care of household chores and or are also taking on sibling care. The increased vulnerability of children to child labor in the wake of in the economic distress that families are facing is a very huge matter of concern. And we have also seen reports of girls being married off very early. So there is a child marriage which had actually come down over the years. We've suddenly seen a surge in the cases of child marriage, because parents find it easier to spend less to get marry of their girls, and also it's one mouth less to feed. Mental health issues, especially among the older children, has become a matter of serious concern, and this could surpass the immediate health and economic impact of COVID-19, leaving a long-term social economic consequences in its wake. Continued care of children with disabilities and children living in institutions, and especially in children's homes and other institutional care, including detention facilities, is a matter of concern too, because we are unable to reach them. We cannot see them so we don't know what really is happening with them. Increased presence of children on online platforms, because that's the only way they are going to be studying, has also exposed them to further risk of online abuse, especially the older children and young adolescents. Childline received 460,000 calls in just 21 days between March 20th and April 10th, which is about 50% increase from their regular call volumes. And this is something that I'm sure has increased since April. Nearly 10,000 of these were intervention cases which required Childline staff to reach out to these children, and of them, 30% related to violence, child sexual abuse, child marriage, and child labor. Nearly 898 child marriages have been stopped by Childline during lockdown. So these are really the crisis that we are facing today. If we were to reimagine a safer childhood, we will need to pay much more attention to core child protection services and to empower our service providers and authorities, including the childline workers. And they have to be considered and continue to be considered, as they are already, essential services in the event of lockdown. The mechanisms for reporting of violence against children have to be strengthened, and the support services have to be much better than they are at the moment, including a way of pursuing more outreach programs, especially since schools and other educational facilities are not functional. Budgets for children and their rights are must not be cut. Those budget lines have to be maintained, and they have to be suitably increased to cover additional expenses that are arising, and have to be allowed with more flexibility in the utilization of the central government funds that are being sent, which are available under the centrally sponsored schemes for the states. The reach and coverage of welfare schemes and measures for social protection that span across food, supplementary nutrition and education, healthcare, and other protection services have to be expanded to include those individuals who are outside the reach of these schemes. Vulnerable children, such as girls and children of migrant laborers, whom Yasmin referred to, and children with disabilities have to be enabled to continue their education. These are just some of the very minimalistic things that we need to do. But for first and foremost, we need to have a real time tracking system of where the children are today, how many children are at what space, especially after the movement of the populations, so that they can be reached with all the services that are available with us. Thank you.
Thank you, Dr. Ganguly. Again, very good focus on child protection rights. Let me ask you: has anything been offered? I mean, has anything been put out on advisories by NHRC or NCPCR as to what must be done during COVID-19 to protect and further the rights of children? And
Thank
how are those advisories received? I mean, are they getting out there? Are they working? Is there an impact?
Thank you, Mr. Gupta. In June of this year, the National Human Rights Commission constituted an 11-member expert committee, which included myself. Uh, and we were given the task in a month to develop advisories on certain issues, which included children, women, mental health, business and human rights, prisoners' rights, um, disabilities, migrant workers. I was the point person for developing the advisory for children. And what we did, but luckily for us, about more than 200 of us children's rights activists, alliances, including the Right to Education, ECCD Alliance, which is Early Childhood Care Alliance, and the Alliance on Juvenile Justice, had all got together to form a draft advisory which we had given to the government. So we had actually pulled together opinions from not just the organizations, but also from children, got their opinions on board and had drafted an advisory, which formed a somewhat of a basis for the NHRC advisory that was drafted. But what we also did was during the formulation of the advisory, we held consultations on webinars with different groups, and we pulled together from Dalit groups, tribal groups, and other groups of like including sex workers, and so that their children's rights are also included. And an advisory has been formulated by and notified by the NHRC, which is available online. It has also been sent out to all the states, and I am told, and that's what I found out yesterday, that the NHRC is actually uh, requesting for an action taken report from the states within a month. So we should know what has happened. Besides this, the Supreme Court of India has actually taken so much cognizance of the situation of children and the child protection issues, and issued two very, very comprehensive orders. So the comprehensive orders of the Supreme Court of India and the advisory of the NHRC can actually form a good framework to address child protection issues. And it is for the states to now take note of it, act on it, and report back on it.
Great, thank you. I'll come back to you again. But in the meantime, I wanted to go back to Dr. Haque and Dr. Haque. One of the important facets of or the areas that's been hit is health, and I would like you to dwell a little bit on the health crisis because this pandemic. Some people were saying 3 months, 6 months, vaccine coming in 6 months, 9 months. Now we're talking a year, 2 years. Where do we stand vis-a-vis the health crisis for children?
So this is really an important one because if we are to build on the gains, make up for the slippages that have happened because of the closure of health services for a certain amount of time, and also addressing the stigma and fear that has come with it, it's really going to be important that we take this opportunity to build stronger and more resilient systems, because this pandemic has shown us that this might not be the last pandemic we face. What happens when the next time we have another virus that seizes the world? Are our systems strong enough to resist it, to deal with it? Clearly, globally, the answer is no, not yet. And so, how we build back, how we not only catch up, but we use this opportunity to learn from the experience, to learn and practice the good systems, I think that's going to be very important, because we have found a way of restarting the essential services. We have found a way of very early on starting to address the stigma and discrimination that comes about, and to keep a focus on how we can deliver services in a safe manner. Services like immunization, which again, it requires cold chain, it requires the trained person, it requires in many cases an injection. How we can do all this in a safe manner, we're all learning from this, and the important part is how do we build back our systems even stronger, taking this into account. You're right. In the beginning, we thought 1 month, 2 months. We know till all the vulnerable groups are vaccinated, we are not going to see an end of this. And even then, some of the basic measures of hand hygiene, of respiratory hygiene, of not going into crowded places, that is going to continue for much longer. And we have to find ways of supporting our families in adapting to this new reality that we face. We've also seen that when services resume, the uptake starts. So we've seen really over the months, the delivery has improved and the coverage of services has improved. So this really means that we have to. It is possible to get back to it, and how we keep an eye on the key elements that have a strong bearing on child survival. That's going to be crucial. And that's where a lot of the guidance notes coming out, whether it's in the health sphere or nutrition or even child protection, it's really focusing on some targeted measures. And we need not just the systems response, but also the community to be reached, for the communities to find ways of supporting that service and doing it in a manner that doesn't lead to even more increase in cases.
We are talking about vaccine, and immunization has been, at the core of every country's move, long strides towards ensuring and guaranteeing health, especially for children. You start with the newborns, and now we're looking at another vaccine for this whenever it comes for this particular virus. And like you said, in the future, I mean, I travel to Africa all the time. We faced Ebola, Zika, so, first COVID, and now the second COVID. Um, do you foresee that we will be able to meet this 6 months, 9 months, 12-month lag or delay due to this COVID situation, 19 situation? And how would we overcome the challenge in getting back into the immunization plan, which was otherwise going very well?
Hmm. No, the short answer is yes, it can be done. So whether it's called catch-up education or catch-up immunization, there are very strong strategies globally that we have. And that's something that can be applied and will be applied. We also know that as the COVID vaccination starts, the target group is very different. It's going to be targeting mainly adults. And so it's going to be, how do we have a two-track immunization system, so that and that's where I think all the planning that's going around it is very clear, that we have to keep the routine immunization for women and for children going strongly while we also take on this additional role. So it does mean it is going to require a whole of nation approach. It's something where, again, I'll highlight the role of the media, especially in looking at vaccine resistance and where we need disruptors or misinformation to be challenged and to give the correct information. So, in a short, yes, it is possible to catch up. It will require a concerted effort, and it is going to require, really all hands on deck, if I can put it that way.
I agree with you, and I think we need to gear up for that quickly while we still have times, enduring whatever form of lockdown that we endure, and maybe another one mini lockdown coming up in Delhi very soon, maybe as early as today. Question for Dr. Dhir Jhingran. The impact on education is severe. When children haven't gone to school, the other things, of course. I have a question from our dear friend Sanjeev Miglani. He's the bureau chief for Reuters, and he says that you've laid out the grave challenges for millions of kids in India and around the world. And of course, now we are looking at the government just adopted and formulated a new national education policy 2020 after whatever 36 years. And there are these recommendations of what to do as priority and how to address the learning crisis. But the biggest crisis that we have right now, in my opinion, is those who don't have access to learning at all of whatever kind. So what do you do? I mean, do you have any thoughts, any suggestions? Have you been talking to the government as an NGO and through UNICEF? Or how do we bridge this digital divide? Because that's the only solution that I can see. Unmute yourself, please. Yes.
We have been talking, I have been talking with the Ministry of Education and the 7 state governments that we work in, and along with UNICEF also. The bridging the digital divide will take time, and I think we should definitely work towards that. The challenge there is not just bridging the digital divide and ensuring that there's digital access with almost every household and child. The question also is, what is the quality of online education that we are offering? Right now, the challenge is that the online education that's being seen in most states is basically one-way lectures. And that also more for the higher grades in secondary and middle school, not much digital content for younger children. So I think we have a long way to go in terms of creating good digital content that can also be interactive, bridging the divide in terms of access and availability of digital devices. In the interim, I feel that we have to depend on the school system. And this is the chance for us, because the public education system really caters to the most disadvantaged children in India today. Others have migrated to the private schools. So in the public school system, I think this is a great opportunity to reimagine what schools and classrooms should do, because there is still faith of the people. They are poor people want schools to reopen, because that's the place where they see their children's education can be continued. So I think it's very important that schools work towards engaging with every child. As I said, equity is going to be the most important one. Can schools address the learning needs of every child? Children who've had very little exposure to any kind of learning during this period, some children who have classes are going to be very diversified and differentiated. So if we can work with our teachers to ensure that they're able to cater to diverse classrooms and to be able to engage all children through a very structured kind of pedagogy, and ensure that they track every child, this is going to be absolutely essential. And also work with, also ensure that parents also support learning whatever they can in their own ways. So for me, I think the most important thing is focus on basic skills that are most important rather than covering the curriculum, the whole wide curriculum, but focus on the most important competencies and skills that children may have missed, and focus on children who are struggling, ensuring that every child gets is able to learn and learn more. So a lot of teacher capacity building is important, and building school and community linkages is going to be very crucial in the coming months and years.
Well, thank you. So that has answered also a question from Pankaj Pandey, Hindustan. Let me move to Dr. Ganguly. There's been a lot of discussion on the impact of COVID-19 on mental health, especially children. And you mentioned in your remarks, that we have to look at the most vulnerable communities across India, the hinterland, poor, wherever people can't reach them with either digital services or others. So this question is also from Alfredo Boada, President Latino. What is being done to reach uh, that part of the population, the most vulnerable population, and how do you get across to the impact on mental health? You have to unmute yourself, please.
Yep.
Yes.
Thank you very much. Um, the newspapers and the news reports tell us that mental health is perhaps, as I mentioned in my opening remarks, more affected even than the physical health of children. Being confined to small spaces, being vulnerable to more domestic abuse, having no contact with peers, um, are all taking a toll on the mental health. There is it is not just that they are becoming vulnerable to mental health in the because of the situation. They're also becoming more vulnerable, as I said, to online abuse, because for those who spend much more time. So what I would like to say is there is an overlaying of existing marginalization with the marginalization that COVID has created, which is deepening and increasing the existing discriminatory marginalizations that all the fractions in the society that already existed. And the pandemic is challenging everyone, but especially it is challenging girls and boys, because their daily routines are disrupted. So the key challenge during these predictable times is the heightened risks of stress. How do we manage that? And what should we do? As of now, really, we do lack in mental health support services in this country. But perhaps the one solution that we need is that the services now need to reach the children instead of the children trying to reach the services, which means that we have to have a very good tracking and monitoring system for with something that Dr. Jhingran mentioned. And there has to be a good information system that enables their access, that enables the access to child protection services and other basic services to reach the children. Um, and I guess that therein lies the solution. We also need and we are seeing this in Jammu and Kashmir, for example. They have actually created district health mental health systems which are reaching the children. So that's the kind of uh, should I say, spread of mental health services. We may not have the absolute specialists, but we can have the community mental health services need to reach the children, along with, as Dr. Jingran pointed out, creating. If you even if you need to take the children back to school, we'll have to give them this psychosocial support to prepare them for it. So whether how good we are at it, I think we haven't yet reached there, but we will. If given this, the NHRC advisory actually makes very very pointed references to the provision of mental health support services through its advisory on children, as well as the advisory on mental health support. It
Uh,
also designates exactly which ministry, which department should be responsible for what kind of services to be made available to children.
One question that has come up from Anjana Prashar and a bunch of other people, Aga Jilani also, is with schools closing, no access to education, not even formal, informal of any kind, and with situation deteriorating at homes because of financial lack of financial resources. Do you see a spike in child labor? Has it been reported? Do you see incidents? And this is both to you and to Dr. Huck, this question. So you can answer it in whatever order.
Yasmin, would you like to go first?
Yes, so definitely, it's a fear. It's based on our programming experience, but it's also coming in our community-based monitoring. And there we've seen that out of every 5 respondents, 2 of them have said that the pandemic and the consequences of it is pushing children into labor. So this is really something we have to take heed of. The child workers are from home returnees. They're also from families who are earning members, have been casual workers. So it's going to be crucial that whatever monitoring mechanism we put in place, which Enakshi and Dr. Dhir both talked about, that we keep an eye on child marriage and children being going into labor. But I also want to flag that there is so much opportunity that we need to take advantage of. One, the type of focus we're getting on mental health and psychosocial support, it's remarkable. And we have to use this as an opportunity to now put in place systems whether it's in the school and for children and teachers, because we cannot forget that the teachers, the health workers, the Anganwadi workers, everyone is affected by this pandemic. And we especially have to look at our women workforce, because they have a double burden in a way. They have their jobs that they have to continue with, plus their work in childcare and home care has not gone down. So how we support women in this is going to be crucial. The other one is, I think, going into the education system. Yes, how we as a nation look at digital literacy, how we look at digital learning, how a blended approach takes into account the different methodologies we have to go for a best outcome for children. Now we see a greater energy around it, and we see that there's need for it. And also in education, the ability to be flexible. We heard from Dhir about how we can talk about remedial education or recuperative education, or how do we do catch up education for the first 6 months, and help the child. I don't believe that keeping a child back in a year in school is going to add to their well-being. It will actually add to their distress. So the system has to adapt to these children and find ways of supporting them in catching up over the next, it might take 2 years to catch up, but surely it is possible. So I think we also have to look at the solutions that we found and how we keep them going, even as COVID comes under some form of control.
Okay, thank you, Yasmin. Just to add, from my field presences, I have been getting information that there has been an increase in in number of children who, because there are two things that are happening. One is because of lack of access to digital education, and because families have gone really poor, children who used to go to school traditionally have now dropped out. So managing getting them back into school, of course, will remain a challenge. But in the interim, because there is a crisis of food and hunger that these families are facing due to lack of employment, children have gone into labor. And we've also got reports of increasing in trafficking of children, that because, again, because families have become indigent, children are more vulnerable. And as I said, there is a layering of existing vulnerabilities. uh, so our role in is has to be both preventive and as well as responsive. And we do have an integrated child protection scheme that talks about creating protective environments wherever the children are. So that really needs our solution today more than ever lies is decentralization of child protection mechanisms and strengthening the child protection mechanisms at the most local level, where the panchayats and the families and the schools and the teachers and the Anganwadis actually take on the role of protecting children and preventing them from falling in through the protective net. And then, of course, there is the response mechanism. So, wherever once the child has fallen through the protective net, how do we rescue them and bring them back into the mainstream? So, both of those are very, very important. But going back a little bit to the mental health prevention and response, I did forget to mention that the Ministry of Human Resource Development and the Ministry of Health and Family Welfare have actually started an emotional well-being and mental health scheme for school health and wellness program, which we really need to intensify and strengthen. And a recently released Ministry of Education guidance also talks about mental health care. And UNICEF, I am told, has partnered with NIMHANS and Childline and is trying to strengthen the primary level psychosocial support for children, which is really extremely good news for us.
My sort of my last question. I'm sure Venkat has a lot of deep insight and thought to put in here, but this stems from a comment and a question made by somebody who's watching this, Ajay Kanchan. Good question. Says the pandemic has turned out to be a windfall for some companies in certain sectors like IT, pharma, and automobiles, and they're reporting much better profits, and even during COVID times. UNICEF is all about advocacy, partnership, and communications. Of course, awareness is one thing, and engaging the world into partnering better with government, private sector institutions. So are we reaching out to these organizations to see how we can help, sort of harness their CSR activities and budgets and drive them in that direction? For example, to use it for meeting the, bridging the digital divide gap. To you, Dr.
Indeed,
Haq.
indeed, it's crucial that we do it, and we are doing it. And I think that's where UNICEF, a lot of NGOs, and a lot of other UN agencies are also very clear that if we look at the global solutions to the pandemic, without the private sector, we would not be getting very far. So if we look at the context of India, how manufacturing has gone up of personal protective equipment, how the N95 masks that were not produced in India, now India is supplying many other countries in the world. The testing kits. So here in India, we've seen how technology is being ramped up and manufacturing is being ramped up to meet the needs, not just of the immense needs of India, but also to take these solutions and offer them to other countries in the world. So this is where, when we work with private sector entities, especially when it comes to looking at the more disadvantaged areas, but also looking at how technology can be used to either bring young people into some form of apprenticeship or employment, how within, if they are increasing on the manufacturing, how can we be looking at business practices on it? And a big effort that we have been making with FICCI has been around family-friendly practices. And we've seen that many corporates have also been looking at positive practices for their own employees. Are their employees getting the type of opportunities that are needed for their children to receive remote learning? How are they being supported in the taking on the preventive measures of hand hygiene, using a mask, etc. So it's not something we, of course, can take for granted. It will require a lot more focus, and we know that the intention is there with many of the companies. We've seen how they have supported us in providing PPE kits for the childline employees, for example, because childline, I think it's shown that they are like an emergency service for the country, and for them, they were moving even when things were tight. And we had to make sure that they were protecting themselves as they were providing a very, very critical service to children. So yes, a lot is happening, but a lot more does need to be done also.
Well, thank you. I'll come back to more if we have time. But in the meantime, Venkat, I'm sure you've heard enough, and on various focus areas, you've also seen answers to certain questions. What are your thoughts, and what are your questions?
I have a question for Yasmin. It's heartbreaking to see that 3 out of every 4 children in India have no access to, learn from online education. They do not have computers or laptops or mobile devices. In India, illiteracy is a big problem. As you know, every third woman in India is not able to read or write. Every fourth man is also illiterate. What are the chances of the UNICEF doing something about this, in the sense that you take the initiative, reach out to, the likes of Azim Premji Foundation, Nadar Foundation, the Reliance Foundation, and the Ministries of Education, and Airtel, and Jio, and Vodafone, etc., and also the manufacturers, to initiate a project to try and make mobile devices available to children, so that they are able to learn. Because the estimate right now is that by the time all the people are vaccinated, for COVID-19, it will be at least 2024. So that means children will continue to suffer because they will find it difficult to go to school or whatever. And as it is, in the past 4 or 5 years, there has been emphasis on digitizing the whole economy. And if you want to operate a bank account, you need to be computer literate and all that. So would the UNICEF consider taking the initiative and approaching, the major donors in this country and private sector companies which have this social responsibility, funds, as well as the Ministry of Education, to see that mobile devices are produced on a large scale and provided to all the children whose parents are not in a position to buy them, so that even college going girl, a girl from Hyderabad who was studying at LSR, she committed suicide because she could not afford to buy a laptop. This is a serious problem. What do you think UNICEF can do in collaboration with private sector and foundations like Azim, Premji Foundation and so on?
So,
Yasmin?
this is really
Thank you.
a very relevant point. And if I can just, take it forward in a way that we've heard from Dr. Dhir that it's not just about having a device, it's about having the content and having the guidance. So it's not, we can't sit a 6-year-old in front of a computer, even if they have a computer, and say, learn. It has to be guided learning. The blended approach has to be there. And that's where working with families and family members, parents, and even we know that there are many children in India, and I've met so many of them who are first learners in their own family. So it's not going to be a one size fits all. And we have to find differentiated approaches for the different groups. Now, we have had a consultation with a number of corporate sectors and partners whom we work with in our Yuva initiative that is really looking at how we can really focus our attention on young people being able to learn, to be trained, and also to be better prepared for the work life. And there we've seen that there is a lot of interest, and we know probably the easiest solution is going to be to get the nationwide network of connectivity going. But the time really is for us to be looking at the material of it, the content that needs to be done. What is the content and how is it going to be guided? Now, no one is waiting for UNICEF or for any other partner to do it. We've seen examples of teachers who have gone online themselves, taught themselves how best to use these approaches in teaching their children. So we have to focus not just on the device or the software, but we have to keep our focus on the teachers also. And this is where finding the good examples, we heard from colleagues of the nuggets of experience that we have in different parts of the country, where whether it's a community taking worksheets forward or it's ways of young people who share their devices. We do need to look at it. And then the challenge in India, of course, is always how do we take it to scale? But we need to come up with a list of solutions that we can do so. And definitely it's one area where we want to be working even more on while we continue. And our focus really is, as I think Enakshi or Dhir was saying, that it's really about getting to those we are not reaching at all first. Because 50% of the children have access to some form of learning. 50% of the 300 million do not have access to any form of learning, whether it's TV, radio, community radio, or a handheld device. And that's where we need to be looking at what are the solutions. We need to nudge the creativity. So I think I'll stop there, but I agree with you. It has to be done more.
Well, thank you, Dr. Haque. We are almost now 75 minutes into this discussion. There's a couple of, I'm gathering all the questions from different people, and I'm just going to put them together. And as last bit, we've looked at the health issue, we've looked at the child protection issue, we've looked at the education crisis. And I think those are the ones staring us in the face as we look at pandemic, when, if ending, vaccine, when, if coming. So have you sort of laid out an action plan in terms of priority between the government, yourselves, and the NGOs that we see here, as to what should be step 1, step 2, step 3? Because now we've talked about 3, 4 broad areas.
You're how shall I put it? We see that the key pillars are one, how we address the risk communication and community engagement. How do we enable communities to take control of their lives and to within their community spheres look at keeping themselves protected and promoting the behavior that is needed to do that. The second, of course, is that we have the infection prevention services available so that either water and sanitation is there, that we have in the hospitals, in the schools, in the Anganwadi centers, the tools that we need so that the services can resume without spreading more of the virus. Keeping the basic services going, and then these essential services that need to continue, which means the health and nutrition services for women and children, the delivery services in the hospitals, the schools restarting, the child protection systems keeping geared up to the need. And then, of course, how are we looking at not just the service side of it and the community awareness side of it, but also the schemes, the type of support that families are going to need, the social protection measures, the schemes that are there. Our communities and those who the schemes have been announced for, are they accessing them or not? So keeping our eye and monitoring and our finger on the pulse is going to be crucial. Now, those are the elements that are priority for us in the response. And sadly, we do have to make choices. We can't go into every little bit of it. But if you were to ask priorities, these are the priorities. But at the same time, within that we look at equity, that we look at gender issues, that we look at issues of non-discrimination are going to be crucially important for us.
But as they say, you can get education, you can get health, you can get energy, you can get water, sanitation if you don't have an economic crisis. The biggest impact of pandemics and horrible things like this is economy doesn't work, and we don't have an answer to that. How, when, who will impinge the economy to return to whatever level, in what shape and form and pace. I don't know if any one of you, because this is a question being asked by many people, what is the economic impact and how do we rise from this? And the whole world is in a shambles. This is not just India. I mean, I live between the US and here, and the US is having a nightmare of a time. So any thoughts on that? Because it does, at the end of the day, that's what causes every impact on the child. We are talking about the child.
I think for me, the point really is going to be that this is the time when choices that need to be made are child-centric. Because unless if those child-centric schemes and essential services do not get a priority in terms of allocations and expenditure, then the long-term crisis is going to be much graver. I'm not an economist. I'm not an expert on how the economy can recover fast. But I think with everything that's happening, finding a way of decent income for those who are most marginalized, for them to be able to take on their work with dignity and with safety is going to be crucial. So whatever planning is taking place, we do need to keep an eye on the most marginalized.
I have one question. I don't understand the context. Maybe you can figure it out. It's from somebody from the Times of India says, what were the wave 1 results? What wave 1? But do you have an idea?
This is with the community-based monitoring. I just talked about the wave 2 results, so they're probably asking wave 1. We can share that. Yeah, we can share that with them later. Yes.
Okay, great. Thank you. Any last comments from any one of our panelists or Venkat before we close?
Well, I think this has been a very interesting kind of discussion. We must thank Dr. Yasmin Ali Haque and Zafrin Chowdhury and Dr. Jhingran and Dr. Ganguly for such an enlightening, enunciation of the basic problem about how COVID-19 has affected, so many children in this country, possibly all over the world. The same thing is happening. Thank you very much. It's a pleasure hosting you and collaborating with you to do this, and we look forward to doing similar events, online as well as in a physical form at the club, and we're going to have a nice meal in our beautiful lawns and so on. Dr. Haque, thank you very, very much. It's been very educative.
Thank you. Thank
Thank
you.
you
And
very
before
much.
we close,
Thank you.
before
Really
we sign off,
appreciate
you.
it.
before we sign off, I just wanted to remind, I just wanted to interject that Zafrin, Foreign Correspondent Club, like in the previous years, will also turn blue starting
Yes.
starting tomorrow and going up to the 20th. So we have been part of that spirit. We join all of you, and from UNICEF, the governments the world over, the civic bodies and the private groups, and we believe that it is an important part of what we do as media and communicators. And it's very, very important for us to highlight issues and to bring the right awareness, to kindle the right steps. And for that purpose and reason, this dialogue has been very enriching and very interesting. And we stand in solidarity with children's rights, and we stand in solidarity with all of you who take care of the future of this world. And we also want to tell those people who are watching us that we will have a press note, and we will have certain other documents which formed part of this dialogue available to the people as an email right after we conclude. So later in the evening today, we'll put that out.
Manish,
Um,
children are the present of this world, not the future.
the present we already comprehend. We are living the present, but it's very, very important. I didn't want to get into these questions because some of them are we could answer these questions forever, but there was an important question which said that children are not that affected, whatever reports are going around, that COVID doesn't medically hit children as badly as it does people with comorbidities and adults. And is that sort of a factor in looking at and considering what you're doing? And I think that we have to move beyond that. If children are not being affected medically that much today, doesn't mean that they don't feel the impact from all the many other reasons. And I think those are compounded reasons why. So I didn't want to get into that, but I agree with you, Enakshi. It's the present, the past we were children, present we have, and then the future. So we will thank you for a lovely session. We will hope that you keep coming back to us, and we give you 2 thumbs up for all the good work that you're doing. Thank you. This has been an incredible
Thank you.
webinar for us,
Thank you.
and we will close this now. Thank you. Good night.
Thank
Thank
you.
you.